Hello everyone, welcome to today's tutorial on how to properly read and understand authorizations for healthcare services. Whether you're a coordinator or a caregiver, or even if you are a patient, understanding these documents is vital for receiving the care your patients, you, or your loved ones need. So let's dive in. Introduction to authorizations. First, what is a prior authorization? Well, it is like the golden ticket to healthcare services. It will tell you what services the patients are eligible for, who will provide them, among other things. Getting started. Now, let's get started. Imagine the authorization document as a map. This is your map, and we're going to explore it together. The header. At the top, you will find the header. This section tells you who the document is for, who issued it, and when it's effective. It is like the cover page of a book. Here, you will notice the information of the patient, such as name, date of birth, Medicaid or Medicare number, insurance ID, and address. Also, you will find the names and contact information of the approved provider, which can be an agency or an individual caregiver. Understanding the purpose. Next, look for the section that explains the purpose of the authorization. Is it for home care, adult daycare, or assisted living program? This is your starting point. Services covered. In the authorization details or services covered section, you will discover what type of care is provided. Is it nursing, therapy, or assistance with daily living tasks? Make sure it aligns with the patient's needs. Normally, on this section, you will find the service description as well as the CPT or procedure code for that type of service. Make sure that you know the codes as they will allow you to differentiate one service from another. I have a whole video dedicated to CPT or procedure codes. You can click here and watch it. But continue with the authorizations topic, let's practice a little bit with one example. Here on this authorization, we can see that the type of service or the service described is home care personal care level 2. If you're familiar with this type of services, you may know that this authorization is for a home care agency and that the patient will receive personal care services in his or her home. Now let's take a look at the code, which is T1019 with the modifier EU1. This code will be used in order to bill for the services provided, usually on a claim form. The code mentioned above is for personal care services. However, if we change the modifier in the code from U1 to U6, the type of service will change completely. Now, with the new modifier, the type of service will be CDPAPS, which is the abbreviation for Consumer-Directed Personal Assistance Services. In this case, a different type of care. Some authorizations will describe the name of the service, but you may encounter authorizations that will only list the code. For that reason, you have to pay attention and search it on the internet if necessary. Now, the next thing we will find is the diagnosis code. Some payers list the diagnosis code on their authorizations to let you know what is the problem that the patient has. Diagnosis codes are very important as you will need them to bill for the services provided. A wrong or missing diagnosis code can be the cause of a denial or a rejection. Duration of the authorization. How long this authorization lasts. It could be for a specific period or a certain number of visits. Understanding this helps you plan the patient's plan of care or your own plan of care. Some authorizations even specify the schedule that the patient should receive, the amount of hours per day, and how many days per week. So make sure you follow this schedule if it is specified, in order to avoid or prevent problems with the payer. Because sometimes if you don't comply with the schedule, the services provided don't get reimbursed. If the scheduled hours or days are not aligned with your patient needs, the patient can call the MLTC or insurance company to have it modified or changed so it can meet his or her needs. Terms and conditions. Now let's read the fine print, the terms and conditions. This section contains your responsibilities and rights, as well as some limitations or rules from the insurance company. Eligibility criteria. Keep an eye out for eligibility criteria. Some authorizations specify the medical conditions or other requirements you must meet. They can also be subject to patient's eligibility. So, for example, if a patient is not eligible, the authorization might not be valid to cover services, and probably you won't get reimbursement. Contact information. To end, we will have the contact information from the payer or insurance company issuing the authorization. You might see the phone number or email you can reach out in order to appeal or get more information. If you would like to change the authorization or appeal the decision made by the insurance company, this should be the number you should call. Now, you may wonder where you can get the authorization. Well, normally the prior authorizations can be obtained through several channels. The first one is the insurance company. You can directly contact your insurance company's customer service department or authorizations department. They often have dedicated representatives who can guide you through the process of the prior authorization, like explaining the requirements and assisting you in submitting the documentation. If the authorization already exists, you can ask them to email or fax it to you. Another way to get the prior authorization is through online portals or apps. Some insurance providers offer online portals or mobile apps where you can manage the patient's authorizations, as well as their information or other supporting documents. You may need a login in order to access. In conclusion, understanding prior authorizations is a vital step in ensuring you provide the care your patients need or receive the care that you need. By breaking down the document into these key components, you can confidently navigate your healthcare journey. If you find yourself struggling with prior authorizations, you are not alone. It can be challenging, but you can communicate openly with insurance companies' customer service. Sometimes a simple conversation can clarify requirements or highlight any potential misunderstandings. Also consider seeking assistance from organizations specializing in navigating insurance hurdles like us. We're here to help. Thanks for joining us today. Please like and subscribe if you want to stay informed about healthcare updates, tips, and recommendations. Remember that this channel is to help you navigate the healthcare industry. I'll recommend you to watch the video on how authorizations can impact medical billing. I will put it down below so you can be aware of how prior authorizations can impact or affect your billing. If you have any questions or doubts, leave them on the comments down below so I can read them. Have a nice day and see you on another video.